I recently got a question about what causes shoulder pain, and the answer is probably a little bit surprising and is going to take some explanation, but I would say air or lack of air. So this is where I'm going to have to explain, and this might be very counterintuitive, but it completely makes sense once you understand what's going on. So with this rib cage, if we're talking about the right shoulder blade, the right shoulder blade will sit at ribs 2 to about 7, right there, okay? In the pattern that we get stuck in, the right BC pattern, on the right, the rib cage internally rotates. So your body weight shifts over to the right and the ribs internally rotate. Now when you're stuck in this position, what you have is a rib cage in the front, a chest wall that gets stuck in a closed position, so it can't expand. It's pretty much collapsed. There's not enough air in this upper part of the rib cage, or in the lower part, but I'm specifically talking about the upper part. When that happens and the air is not properly inflating the rib cage, the ribs move closer together because they're internally rotated, and that throws off the relationship of the rib cage to the scapula. The rib cage should be round, and the scapula should also be round. When they're both round, they have a good, I'm just trying to round this scapula right there. When they're both round, they have a good relationship. The inside of the scapula and the back of the rib cage. They're in perfect concave-convex relationship. When the right side is smushed down because you're stuck in right stance, you're on your right side and you can't get off it, and there's not enough air, the ribs and the scapula lose that relationship, so it's unstable. It needs air underneath it to restabilize. So without enough air in the upper right chest wall, the ribs are not in their normal resting position, which causes instability of the right shoulder blade because it doesn't have all those ribs to rest on in the proper position. The relationship is off. So you have scapular instability. So the way to fix it is through proper breathing. And in particular, what we're always looking for with breathing is the ability to inflate the upper right chest wall. And that's one of the main PRI tests. It's called Apical Expansion. And it's to see how well you're getting air into the upper right side, because we know when you're on your right side, because you're internally rotated with these ribs, you are going to have limited ability to expand your right chest wall, and that will tie you over to the right side. Now, I can even see it right here. See that right SCM? Once you're stuck to the right and your head has to then come back to the left to stay straight, that right SCM becomes overactive, and now it contributes even further to dysfunctional breathing, and it further closes down this right chest wall. It will also keep your neck oriented to the right. Now you've got all these hyperactive neck muscles, especially the scalenes, and they're pulling on the rib cage and further messing up this relationship of the rib cage to the scapula. So again, what you have to do is inflate the right anterior chest wall. And that's done through pretty much every postural restoration exercise is attempting to do that. The other thing that you're going to have to do is get off the right side. So if you watched my video about the right medial arch, how you can put a little bit of a paper towel underneath your right arch, that's sometimes people can't get off the right side because they don't have the ability to pronate that right foot that then pushes them to the left, and giving that little arch can help. So a right medial arch might be the best thing you can do for that shoulder, because it will then allow the right chest wall to expand with air and reestablish that concave-convex relationship. Now there's one other issue that you have to think about, and it's a subclavius muscle. So the subclavius, I don't have a collarbone here, but you would have a collarbone that's coming right here, and it covers the first rib, so you can't even see the first rib. But if you put your hand on the right side, if you take your fingers and you put it, kind of dig it underneath the collarbone, and so up and back, you'll probably find the right subclavius. And on a lot of people, that's become really, really tight because of this shoulder blade position, and this overactive neck musculature is pulling the ribs, this first, second, and third rib, are pulling them up into the collarbone. And it gets tight and it gets stuck, and then because the collarbone is part of the whole shoulder complex, it further throws off the convex-concave relationship of the scapula to the ribcage. And that is pretty much it. Once you restore proper position, so if you have watched the video on the left ZOA, you know you're trying to get full exhalation on the left side, so that your body can shift to the left. When that happens, the right side should open up, and that should help reestablish the proper relationship of the shoulder blade to the ribcage, and that scapular instability should go away. However, if you have a tight subclavius, you may need to massage that to release all these muscles. Otherwise, it might not reestablish that proper relationship, because the subclavius, it's small, but it can wreak a lot of havoc on people's bodies because it alters all your rib motion. And if a ribs can't rotate, spine can't rotate, neck can't rotate, you're kind of stuck. So I would say most right shoulder pain is due to an uninflated upper right chest wall that has to inflate with inhalation while keeping the left ribs down. If you keep the left ribs down, the right side has to open up, the rib cage has to expand, and that will reestablish the proper relationship of the scapula and the rib cage.